And actually, speaking of health, technology in the medical field is advancing at lightning speed.
Here's Alex with one of the most impactful innovations.
Now, when I say the phrase proton beam therapy, it may sound like I'm talking about an episode of Star Trek or maybe something from the movie Back to the Future, but it's actually a real thing, and it's making waves in the fight against cancer. Here to tell us about it is Dr. Samir Kioli. Welcome, doctor.
Thank you for having me on.
It's great to have you on. So let's talk about what I just said. What is proton beam therapy?
Sure. Proton beam therapy is a form of radiation therapy. Most people know somebody who's had it. 1 of 5 Americans will receive radiation therapy at some point in his or her lifetime. So X-ray therapy it can kill cancer cells, but it's like a chest X-ray. You can't stop it. So if you have a brain tumor, it would go in one side, but the X-rays would come out the other side. Proton therapy is a charged particle. It's all it is. It's the H of H2O, and you can put a set charge on it. It'll go a set distance. It'll stop. And so, for instance, take, for example, a glass of ice water. X-rays would treat the entire glass. Protons would treat the ice cube, but could spare the water.
Man, this is cooler than sci-fi. So how does Mayo Clinic actually decide which patients receive this type of treatment?
That's a good question. And, it depends on kind of the totality of everything going on with the patient. But broadly speaking, we look for patients who would derive the most benefit, who have a life expectancy of several years, and also where we're trying to avoid something and where there's critical structures. So, for example, pediatric tumors make a lot of sense because kids are growing and have a long time and are very sensitive to radiation. But we've used it for a variety of adult conditions, including prostate cancer, breast cancer, esophageal cancer, lung cancer, and brain tumors. For example, in breast cancer, especially on the left side, the heart sits right below the target, so we can reduce the dose to the heart by 90%.
Wow. And so very much like, old computers, this technology actually requires a lot of space and, a lot of investment. So why does it need such a big building?
Yeah, so protons, although they have the smallest atomic mass unit of just 1, they're still, the wrong physics term, but they're heavy. And so imagine a big semi-truck, 18-wheeler with 80,000 pounds of payload going down the freeway at 80 miles an hour. When it exits, it can't take a sharp turn like a sports car. It has to take a nice shallow turn. Likewise, protons, we need something the length of a football field to accelerate something the size of a pencil tip, but we have to steer it over a great radius, and that's why the facility is so big.
Incredible. And now with such strong radiation, people might ask themselves, is this actually safe for kids?
Absolutely. So, and actually at the end of the path, the radiation delivered isn't that much different than an X-ray. It's just, it gets there much more efficiently. Usually delivering 70 to 80% less dose to the surrounding tissue. But the end effect on the cancer cell is the same.
Okay, and so what can a patient sort of expect once they've undergone this therapy? So, proton radiation will decrease the dose to the normal healthy tissues by quite a bit. So normally patients will have maybe less fatigue, less nausea, less vomiting, depending on the area we're treating. But it's still a course of radiation that might be as short as a week, might be as long as 7 or 8 weeks. Right. Well, folks, if you had any doubt that we're actually living in the future, here's the proof. Dr. Samir Kioli, thank you so much for talking to us about it and sort of breaking it down very simply so that we can understand it.
No, thank you for having me on.
All right. Now stay where you are, guys. The Morning Blend will be right back.